whereas these things have created a kind of wariness and distrust among the public and our policymakers alike. Now, what are the concerns? Well, the literature has given us evidences such as acute radiation sickness, which happens when a large amount of radiation happens in a single shot. Whereas we also have chronic diseases such as low dose being exposed to for a long time. Meta-analysis has, by the New England Journal of Medicine, has shown that uh, a long-term exposure to nuclear energy has given a low birth weight, has risks of miscarriages, and a lot of cardiovascular risks to residents around the nuclear reactors. And it's also has been documented risks of leukemia in the workers that are working in the nuclear plants. Now, these have been already documented. So what have we done? So the existing policies include carbon taxation and collaborations. And then we have nuclear associations such as the CDC, the International Atomic Energy Association, who demand for biofuel demands instead. Now, we have found out that most research are in medical workers and not in nuclear plant workers and residents around nuclear reactors, which we like to advocate to. Now, what are the policies and recommendations that we're going to give? Can you scroll down, please? Yeah, thank you. The first one would be to be prepared in case of an emergency and to be protected and secure. We need to have radiation emergency kits and emergency supply kits, which are made by supervision committees and be available to the families residing around these nuclear reactors, and an exit plan so that they can escape in case of a radiation emergency or a nuclear explosion, and make sure that they are well equipped and trained enough. Can you scroll down, please? The next would be recommending international agencies, and they will create advisories for the national agencies. These international agencies should collect resources around the world and create a lot of think tanks where they can adopt new policies and recommendations for the better safety of nuclear reactors and the better disposal of nuclear waste. These advisories are taken by the National Health Ministry, which is our next advice, where they will execute according to local needs and cultural requirements, and make sure that enough funding in a local region is allowed so that they can go forward with those advisories. Next page, please. Finally, this is our international position. Strongly urge the national governments and health ministries to practice a transparent and comprehensive licensing process for the construction and decommissioning of nuclear facilities, recommending national governments and health ministries for proper operating conditions and prevent unwanted nuclear accidents, to encourage international agencies for better dissemination of information and knowledge. And we urge nuclear energy companies to promote enhanced security and emergency preparedness. Thank you. That's for Group 4.
Thank you, Group 4. Thank you for a wonderful presentation. Now, we move on to Group 5. Representatives from Group 5.
Hi all, could you hear me?
Yeah.
I'll share my own screen then. Okay, so our topic for us is about the processed meat, of consumption of processed meat, and how we can use public awareness to discourage consumption and push for healthier alternatives. So we have a lot of scientific sources that we looked at, and these come from the WHO as well as other highly recognized journals. And we looked at a lot of research that covers about the effect of consumption of processed meat, as well as how and which policies are most effective when it comes to discouraging its consumptions. And so here's just a list of all of the researches. And Malaya, I think Malaya from Malaya, sorry, Malaya can talk about the second half of the paper, if that's okay.
Yeah, which part? Sorry.
Yeah.
Which part?
We can talk about the policy implementation and go more in depth about
Okay.
it. So in our executive summary, we recognize that there are cultural and economic barriers when it comes to reducing red meat consumption, and that um, healthier dietary choices are fundamental to improving population outcomes. We also recognize that dietary guidelines, public health campaigns, academic institutions, and NGOs are all important avenues for uh, reducing red meat consumption, and that it can overall build to a more healthy and sustainable global food landscape. And so in our discussions, we talk about um, the nuance and complex variables that we need to take into consideration for this policy. And for example, processed meat, right? There are lots of different types of processed meat. So even though they all go under the same blanket, they could be, they could have different health impacts. So for example, um, bacons and sausages would have a different impact on your health compared to pork, right? One is clearly more unhealthy. And there's also different ways of measuring their quantity. So, for example, they would all have different levels of cholesterol, fat, and preservatives. And so uh, these are also things that we have to take into account. And then we also have to take into regional disparities. For example, Western Pacific is actually not as high of a meat consumer compared to the US and North America. But then nonetheless, we should still strive to reduce um, red meat consumption as much as possible. And the second thing is that a lot of the countries in Southeast Asia are developing, and developing economies tend to correlate highly with um, red meat consumption increases. So that's also something we have to take into account. And so Malaya can talk about the policy interventions and the recommendations for stakeholders.
Okay, thank you for the opportunity. So let's jump into the implementations that we can do. So the first one is about we can also encourage people more about eating less processed meat by really try to prefer the literal or the raw meat itself. I mean the red meat labeling rather than the packaged meat. And for the production and the manufacture, we can implement that the processed meat package. We can give the depiction of the daily intake recommendation so that the buyer can see it and remind them to really eat the processed meat and the safe amount of range amount of maximum amount of processed meat, and also really to, for example, really embracing the campaign about eating less processed meat and by starring influential people, for example public figures, to really um, disseminating all the negativity, for example really influencing people that processed meat is not that good for the health. I think like Ivan can add more, or yeah. And also for the school itself, we can educate the students, for example, by, for example, the meal prep itself. We encourage the parents as well from a campaign, for example. Is there anything that can you add more? Like, thank you.
Yeah, so not only do we encourage through soft power that people should eat red meat less, we can also directly supply healthier alternatives through school programs, hospital programs, maybe even prison programs. And so we can curb the impact of
Thank you, Group Five. Sorry, due to time constraint, I have to stop you there. But thank you for the interesting presentation. So, can we move on to Group Two now? Group Two, representatives of Group Two. Hello, Group Two. Oh, okay. Please share screen. Thank you.
Good afternoon. Please allow me to represent group two. Shitanya, can you please help for the screen sharing? Thank you.
I already shared this screen. Is it not
Okay.
visible?
Okay, thank you. Please let me introduce myself first. I am Danny from Group 2, and here we are bringing the topic of NTDs for our position paper. So the NTDs are a group of diverse infectious diseases that primarily affect populations in low-income and developing countries, particularly in tropical and subtropical regions. This group encompasses a variety of bacterial, viral, parasitic, and fungal diseases as well as toxins. These are termed neglected because they historically receive less attention and also funding compared to other major global health issues. Here we have identified the vulnerability factors in NTD affected neighborhoods, which are poverty, climate change, genetic and biological factors, gender-based inequality, and lastly, HIV or AIDS. Now, why is it important for us to bring about NTD? Here, many NTDs are chronic diseases that develop slowly over time. If left undetected or untreated, these conditions can worsen and cause irreversible damage to the affected individuals. This highlights the importance of early detection, timely treatment, and also ongoing management to prevent long-term consequences. The second thing we will be talking about is the WHO roadmap, where it has played a crucial role in the global efforts to combat NTDs. In 2012, the WHO launched the roadmap for NTDs for year 2021 to 2030. This provides a strategical framework for addressing NTDs over a 10-year period and aims to accelerate progress towards the control and elimination of these diseases, which have 4 points. The first one is the 90% reduction in the number of people requiring treatment. And then the second one is 75% reduction in the disability adjusted life years. And then we also need at least 100 countries to eliminate at least one NTD. And lastly, eradication of 2 diseases, which is the guinea worm disease and also yaws. And over time, over our discussion, we have identified a total of 7 stakeholders. The first one is the national governments and health ministries who can integrate robust implementation of NTD's control program and element to the WHO roadmap. And the second one, we believe that international agencies such as WHO, UNICEF, and World Bank who can guide, implement, and provide funding and also research methodologies to the government in order to achieve the 2030 target. Then the third one, we believe that NGDOs can help in facilitating public-private partnerships, capacity building, and community engagement. The fourth one, we believe that pharmaceutical companies should collaborate with the government to provide inexpensive, effective, and affordable drugs, which should be monitored by pharmaceutical regulating authorities. The fifth one is we believe that donors and philanthropists can provide funding for accelerating the fight towards NTDs. And then we also believe that medical schools shall encourage medical students to actively address and advocate for the NTDs affecting millions worldwide through participation in youth evidence-based policy decision-making process. The last one is we believe that the mass media is an effective tool for raising awareness, and we should provide the authentic data presentations for the citizens in order to understand and improve their health-seeking behavior through education. The last one is we will restate the AMSA international position, which we have summarized into 4 points. The first one is reaffirming the importance of the London Declaration and the WHO roadmap to eliminate and eradicate at least 2 NTDs across the African continent. The second one is we believe that greater awareness should be cultivated in society with the role of global youth and organizations. The third one, we should be fully convinced that the problem of NTDs can be controlled by addressing the institutional, technical, and budgetary issues that have been hindering the WHO roadmap adoption among African member countries. The last one is we strongly recommend the national governments and health ministries of African countries to strengthen their research capability and capacity, also develop new funding schemes and develop new frameworks in collaboration with the NGDOs and donors to optimize implementation of the roadmap. So here we have the diagram, which displays the NTD stakeholder relationship, and that will end my presentation for today for the second group. Thank you so much for the opportunity. Thank you.
Thank you, Group 2. That was a very detailed presentation. So, can I move on to Group 1? So, representatives from Group 1.
Okay, I will present for Group 1. Can
Thank
someone?
you. You may share your screen now. Oh, thank you.
Okay, can someone help me for the... Okay, thank you, Katrina. Okay, so please allow me to introduce myself first. My name is Jen, and I'm going to represent for Group 1. So we're talking about the air pollution. Okay, so the air pollution poses a severe threat to the public health, especially in the low middle income countries. And as we can see that the World Health Organization reports that 92% of the population, especially in Asia and in the Pacific, face elevated air pollution level. And in 2015, the majority of global health attributed to outdoor air pollution occurred in East Asia, and also in the Pacific, about 35%, and South Asia, about 33%. And this issue is exacerbated in low middle income countries, where many people live in congested areas, like lack clean cooking facilities, and also face economic challenges. And this results in health problems, including respiratory issues, cardiovascular disease, and also low birth weights in infants. And based on the World Air Quality Reports has unveiled some concerning data too, that Lahore, Dhaka, and also Kuala Lumpur are the three most polluted large cities, and highlighting significant air quality challenges. And okay, maybe we could scroll down to the background. Okay. All right. So what happens right now between the public government and also the stakeholders is that it's actually not lacking the awareness, but instead it's lacking the quality of information available about local air pollution and health risks. The current communication is focusing on air quality without explicitly connecting it to health. And although some sources mention health risks, they are seen as insufficient, and the existing information sources are criticized for not effectively translating scientific data for the public, particularly regarding the air quality index, and it's leaving people confused. And consequently, the lack of timely data exchange and not translated scientific data hinders all the benefit of pollution mitigation efforts that have been made from all the stakeholders. And maybe you could scroll down more to the part 4, I guess. And also about the relationship between regulation of air pollution and economical status. For example, in East China, a 1% increase in per capita emission over the last decade resulted in a 0.02% increase in GDP per capita on average per year. So it's really concerning in the economic sectors here. And also, what action have been taken to tackle air pollution? Maybe you could scroll down a little bit more down. Okay, more. Okay, here. So there are several actions that have been taken to tackle air pollution. So the first one is a case study, I should say, in Jakarta. There are several strategies involving controlling air pollution through policies and regulations, and then reducing the emissions causing pollution by enhancing the exhaust inspection of vehicle and encouraging the use of public transport, and then to call people to check the air quality before performing outdoor activities, and also to implement the combined working mode, including working at the office and doing it at home. And also in Bangladesh, although it's not effective, they're trying to monitor and do large-scale implementation programs, including demolitions of hundreds of illegal bricks clean throughout the country, and also enhancing the clean air law. And for our recommendations, okay, you could scroll down. Okay, so we have several recommendations here. The first one is that we could identify the most suitable monitoring technology that may vary based on specific circumstances, as not every low mix or every low middle income country have the same conditions. And for example, low cost sensor device and satellite based measurements are recommended. And the second recommendation is that translating data from monitoring infrastructure and publishing it to the public and stakeholder as an easy read information. And the third is to establish regulations and law regarding air quality standards, including fines or also and penalties applied, and carefully design facilitated dialogues among public and private sector stakeholders in order to meet the local needs of stakeholders and improve social responsibility among companies. And the last one is to we recommend the public to wear a mask to prevent them from respiratory health or other health problems. And the last part is the position of AMSA International. Yes, so as an organization for medical students, we are responsible for enhancing comprehension and also exchanging insights into resolving them. Therefore, AMSA International needs to participate and call on significant medical sectors in raising awareness of the public and stakeholder, as well as helping in the research data. Okay, I guess that's all from group 1. Thank you for the opportunity.
Thank you, Group 1. So, can we move on to Group 3? Representatives from Group 3. Thank you.
Okay, hi. So for our presentation, so I'll be going briefly over the background and the discussion. So for our group, so we'll be presenting our policy document on a a policy draft on community-oriented pandemic preparedness. So for a brief background, so over the past few years, so the COVID-19 pandemic has revealed and exacerbated various systemic issues that continue to plague our healthcare systems. So mortalities and morbidities due to the disease itself, post-acute sequelae, delay of care, and mental health illnesses have been on the rise. So more than being an infectious disease, it's evident that COVID-19 has affected other aspects of health. So with these issues, coupled with rising misinformation and disinformation, professional dissatisfaction, and worsening health disparities, implore us to come up with evidence-based solutions and policies as we rebuild our healthcare systems and institutions as we live in this post-pandemic world. So in the past, the world has actually faced various pandemics and epidemics. Despite this, the global and national healthcare systems continue to struggle in handling, containing, and managing the current COVID-19 pandemic due to various systemic issues. So firstly, looking at the health-seeking behavior of populations juxtaposed with current policies, it's quite evident that there's a need to improve the integration of behavioral and anthropological perspectives to effectively create policies that address the needs of the people while also involving them in the decision-making process. Secondly, it's also evident that the current healthcare systems and infrastructures were unprepared to handle the sudden volume of cases while also managing the non-COVID cases on top of the rise of COVID-19 cases. So with this, so it's quite evident that there's a need to adopt a whole of society approach to harmonize the current efforts in addressing the health needs of communities. So with this, my partner will be presenting the policy recommendations that our group has come up with.
So for recommendation, we have a general recommendation that there must be coordination between the government and community actors in every sphere of health delivery. There must be better and reliable communication to the community. There should be focus on the prevention, as vaccine coverage is the most cost-effective approach by the systemic reviews. There should be appropriate containment measures in the community by forming community health boards and by providing the specific PPEs and stuff. All actors in the policy making and delivery should ensure equitable health delivery. For this, we support research and innovation for delivery of new medical measures. So, and as per the AMSA International recommendation for various stakeholders, we recommend the government for the following action. As it has been shown, where community-led organizations have capacity and authorization, they can provide cost-effective pandemic health services and improve accountability. So for the implementation, we recommend that better health systems for financing the community-led organization. We should develop and implement comprehensive pandemic preparedness and responsive policies that take into account the specific needs and the vulnerabilities. We also want to establish the monitoring systems for the continuous evaluations of the risk. For the community, we recommend that as community-led responses, partly the work of organization led by and accountable to people from the affected communities, often bring trust, establish lines of communication, and reach the marginalized groups when the government cannot. So we recommend develop community-based pandemic management, educate the community members about the risk and the impacts, and build strong community networks. As for the EMSA International recommends WHO for following actions. That there should be an international collaboration because pandemic is a global phenomena and everyone is affected equally. And there should be a development of medical technology as the expertise of the world combined could accelerate it. And there should be an campaign to combat the misinformation and disinformation as was evident in the COVID pandemic, the widespread. So for this, we want WHO to establish a high-level working group, including governments, local representatives, NGOs, and supranational organizations. We ensure that the collaboration between organizations responsible for the development of medical technology ensure that the misinformation is uploaded at all levels of society and that national governments provide correct and trustworthy information. For EMSA International recommends media companies and organizations because the media organizations play a vital role, and I would say the only role in the spread of reliable information regarding public health care. They are dangerous because they can weaken the level of pandemic preparedness. So we should establish strong democratic ethical standards for the conventional media, establish community guidelines for the local media, take proactive measures to moderate community discussion on controversial health topics, consider placing restriction, though it is against the freedom of voice, but we should place some restrictions on the personal reach and authority of some person who have a great reach. An independent review board consisting of ethicists, public communication experts, and healthcare professionals. AMSA International recommends that local healthcare providers that the local healthcare providers are often the first point of contact, so they should play a role because the vaccine distribution is in their domain. Healthcare provides an important source of pandemic-related information. So the implementation, we should develop a comprehensive emergency response plan, specially tailored to pandemic
Sorry.
situations.
Thank you, Kufri. Sorry to cut you off there. Due to time constraint, I think we should move on to our next group. Thank you for the presentation, though. Group 6, with the representative from Group 6, please share your screen. Thank you. Representative from Group 6,
Oh, all
are
right
you
then.
there? Okay, perfect.
Okay. Wait, I want to share screen first. So it's still loading. I think okay. So my name is Fitranda. I am from Group 6, and here is our policy document. So from Group 6, we talk about access to healthcare for all. So in here, we jump for the executive summary. So the financial barrier of healthcare access policy is a focused framework aimed at reducing or eliminating the economic challenges that individuals and community face when seeking essential healthcare services. And in here, for the global situation, according to WHO, up to 3.5 billion people, almost half the world's population, lack access to the health service they need because there are so many challenges in here. First, we talk about financial barrier, for example, like high healthcare costs, and then access disparities, especially in LMIC countries. And the next is quality of care because like there's different healthcare system in here and the quality disparities between those hospitals. And the next is geographical disparities, especially in like multiple island countries. And the next is technological advancement. And for the financial barrier to healthcare access, like there are two repercussions of these financial barriers. Individuals either avoid or postpone needed healthcare, or households incur high amounts of debt or loss of income linked to healthcare. Another important financial barrier in many settings is the loss of income or the opportunity cost of seeking care. For example, like we in the US, the high increase of household pricing also reduce the spend in healthcare access. And the financial barriers of healthcare access, like the top priority is first is the out-of-pocket costs, and the next is lack of health insurance and lack of insurance coverage, transportation costs, child care costs, and discrimination. Actually, there are so many policy options to address this, for example, as stated in here. So I just continue for the recommendation in here. So like as I mentioned before, financial barriers to healthcare can have a significant impact on people's health and well-being. They can deter people from seeking necessary care, leading to poorer health outcomes and higher mortality rates. Firstly, for hospital, we have a clear justification in here. Like a study found that hospital pricing transparency could reduce the price of laboratory and imaging tests by up to 27%. In here, therefore, we recommend that hospital disclose the pricing for every service provided. This transparency can lead to significant cost saving for patients. And secondly, for the Ministry of Health, this in the same study, talking about the hospital quality transparency could help in decrease the overall level of growth rates of healthcare spending. But to be noted in here, there's also increase the price and payment in context of higher ranking or rated facilities. In response to this, we recommend equalizing each healthcare provider facilities to make healthcare services equal in every place. We also suggest building independent bodies on alternative dispute resolution or to resolve disputes between healthcare providers and insurance companies. Yeah, and this is because like there is some countries that do not have universal health care coverage, so they rely on like a private insurance company. So the dispute resolvement urgently needed in here. Lastly, we urge each hospital to properly disclose their quality transparency. And for the healthcare plan providers, in here stated that the financial barriers faced by the public include affordability and expected bills, non-covered benefits, billing errors, service denial, and eligibility barriers. To address these barriers, we recommend incorporating the Health Advocate Partners Program. In this means that this program provides health insurance and health system navigation assistance, educate residents about their right and limitation in the healthcare system, and improve their healthcare literacy. We recommend each healthcare plan provider to comprehensively work together with health advocates and educate residents about the healthcare system to provide better solution in search of a healthcare plan. Because in so many cases that the resident they like didn't have so many knowledge about what kind of healthcare plan at how does it work and the benefit and the disadvantages of using those plans. So in here the health advocates will be could provide better solution in here. And in conclusion, this recommendation aims to improve transparency, equality, and literacy in our healthcare system. We believe that this change will significantly improve healthcare access and affordability for all. I think that's all from me. Thank you.
Thank you, Group 6, for the wonderful presentation. Now, can we move on to Group 8? Representatives from Group 8. Thank you.
Okay, so good day. I'm Shaina from AMSA Philippines. I'm from Group 8 and we chose microplastics and plastic waste on environmental health. I'll be dividing the presentation in three parts: of background, discussion, and our recommendations. Just a brief background about microplastics, water pollution, and its effects. So microplastics are tiny plastic fragments measuring about 1 micrometer and 5 millimeters. And being smaller fragments, they're ingested by various marine organisms and can potentially enter the human chain. Plastic waste pollution is a global crisis with approximately 8 million metric tons of plastic waste entering the oceans annually, harming marine life and ecosystems. Microplastic exposure raises health concerns due to their presence in the environment, and ingestion of microplastics can lead to GI tract issues and organ tissue accumulation. Inhalation may cause respiratory problems, where dermal exposure can raise concerns about skin irritation and tissue penetration. And plastic waste constitutes a significant portion of marine pollution, with coastal areas being significant contributors, and mismanaged waste add to ocean pollution annually. Next, I'll be talking about the existing policies. So current global policies on plastic use primarily target the environmental and health risks linked with plastic production, consumption, and disposal. And key policy interventions include your plastic bans and restrictions, effective plastic waste management strategies, regulation of harmful chemicals used in plastics, food safety regulations, labeling and design requirements, and research initiatives focusing on plastic population and microplastics. Additionally, there's a growing emphasis on circular economy policies to promote the use of recycled plastics and minimize resource wastage. Going to the next part, which is the discussion. So microplastics have become a global concern due to their vast presence and adverse impacts on health and environment. Current estimates suggest a staggering 5.25 trillion plastic particles in the world seas, with projections of an increase in plastic pollution. The production of plastic has surged over the past decades, with China being a major contributor, followed by the European Union and North America. Sorry. Okay. Next, the hurdles in handling microplastics and plastic waste. So this includes small size and widespread distribution of microplastics, and understanding the ecological and health impacts is crucial for effective mitigation. Plastic pollution in ocean requires both preventive and cleanup efforts, and technological limitations hinder effective microplastic capture and removal. Global policy implementation and public awareness are essential for reducing plastic waste. Adequate funding and continuous research are vital for developing solutions and understanding the problem better. Now for the interventions. So interventions to manage microplastics and plastic waste encompass microplastics and improving recycling and the circular economy, enhancing waste management infrastructure, implementing cleanup technologies, cleanup and waste reduction technologies, improving product design and packaging, encouraging consumer behavior change, promoting corporate responsibility, and collaborating with nonprofit organizations. And to effectively mitigate the impact of microplastics and plastic pollution, a comprehensive collective effort involving governments, industries, communities, and individuals at local, national, and interlevels is essential. Collaboration and a multifaceted approach are vital to reducing the adverse effects of microplastics and plastic waste on the environment. Then now for our recommendations. So AMSA International recommends governmental actions such as legislation to regulate plastic production and emission to combat ocean plastic pollutions. NGOs are encouraged to raise awareness, conduct research, and collaborate with stakeholders to develop solutions. Communities and individuals are urged to encourage in beach cleanups, reduce plastic consumption, and promote responsible waste management through education and awareness campaigns. Now for the position of AMSA. So AMSA recognizes the severity of the global plastic waste crisis, especially microplastics, and its detrimental impact on the environment and its public health. AMSA commits to combat this issue, advocating for reduction in plastic production, efficient recycling systems, innovative technologies for microplastic removal, and behavioral change. Collaboration, research, evidence-based policies, and international cooperation are seen as critical components to combat plastic pollution comprehensively. And we urge stakeholders to prioritize initiatives aimed at addressing the pressing concern, aligning with principles of sustainable environmental stewardship and public health for a cleaner, healthier future. That's it for. Thank you.
Thank you, Group 8. Now, last but not least, can we have representatives from Group 7? Okay.
Hi. Hi, we are Group 7, and we are presenting our policy document on the assistive technologies for health. And let's move on to the background. And for the access of assistive technology, there are some barriers, like the lack of resources, like the financial support from government and private sectors. And also there's lack of awareness in public and also in some institutions. They cannot be aware of the problem of assistive technology, which will be shortened as AT in the following. And let's move on to our discussion. To deal with these issues and overcome the obstacles, and we divided our recommendation into two parts. And the first one will be human resources, and the second one would be research and information system. And for the human resources part, because in many countries there are not really enough well-trained personnel, so ANSA International recommends government and NGOs to share information across all groups, all parents, teachers, and experts in the personnel, and also increase training and education, like holding some workshops about the assistive technology, the AT, and to address the gaps in knowledge and skills. And for the research and information system, since it is really crucial for us to know the needs in population. So to estimate the needs, ANSA International recommends government and technology companies to conduct a disability survey to estimate the population needs. And based on the data of the survey, establish information system for population needs assessment. And we talk about some key factors of the system, like the collection and the analysis of the needs of the population. And also, ANSA International recommends private sectors to encourage and invest in research and innovation of AT, because it is, like I mentioned before, it is really of lack of awareness. So we'll have to enhance the awareness of the stakeholders or some governments. So we have to recommend the private sector to invest in the development of AT. And also, since it is a global health issue, so we could promote regional and international partnership in the development. And then for the recommendation for other stakeholders, ANSA International advocates for family and caregivers to actively participate in the decision-making process and the execution of the policy. And because we requires the involvement of disabilities and the elderly. Also, International recommends university and research institutions to contribute to the development of this research, AT research, and really collaboration with each other to make the development better. And also provide some sufficient AT access for their students with disabilities. And to wrap up, ANSA International affirms the urgency of providing the policies for the protection of AT, also as well as the develop its supporting sectors. So it is really crucial to educate the public, assess the AT needs in the population, and also create needed system. So the above is our report. Thank you.
Thank you, Group 7, for this interesting take on artificial technology. You all did a great and amazing presentation, all of the groups just now. I was amazed and stunned the whole time. Now, let's hear some feedback from the Director of Global Health who initiated this program. So, Cindy, the time is yours. Thank you, Cindy.
Okay, thank you very much, Stan, and my greatest gratitude and pride to all of the groups and writers, all of the group moderators, and all of the GHOC. It's really, really exciting to see all the recommendations and the progress in such a short time. Thank you very much for your dedication, everyone. I truly hope that everybody will get something out of this experience. So I'll be dividing my input to 5 parts. First will be the process of brainstorming. I'm really glad to see diverse topics. It's all different for all 8 groups, and we'll be having a post-event report later on to briefly touch on that. So your chosen topics will be posted on AMSA International's Instagram. I think there are 2 main considerations in picking the topics, urgency and relevance. So an urgency, of course, we know about what it is. It's about the magnitude of the problem. It's about how severe the problem is. And I have also seen some groups having substantial discussions on that. And secondly, would be the relevance to ourselves in the context of medical students in this context. I'm talking about interest or passion of you yourselves as writers of the policy document. And I'm also talking about contingency when I talk about relevance. So is there like another actor, like another stakeholder, which has been working on the policy recommendations of this? Will us writing about this topic be something that's actually bringing impact to the issue? That's like another consideration. And I really do understand that perhaps it's very limited here. We can only talk about it through WhatsApp. And because we have limited time, many have resorted to pollings. That's also great to speed up the process. Next to my second part about the process of researching, I think from yesterday's session, we've also gotten that systematic reviews are great, but it's not always applicable as well. I believe you guys have also experienced that when you guys are writing down the policy document. So it really depends on the question. If we want to talk about, for example, the current situation, then perhaps prevalence studies or population-based studies will be more useful. When we talk about like the cost effectiveness, perhaps effectiveness studies are more useful. So yeah, it really depends on the question and like what kind of topic we're writing there that we have to discuss upon. And shout out as well to Group 8 who have included a list of policies reviewed. You can see it here. Yeah, I think this is really interesting because we need to recognize that we are not the like the first people to like write upon these topics. So it's really great to see like what other institutions like OECD or ASEAN or like so many other think tanks have written about this or have made policies about this. I believe that will be great resources as well when we want to research about the policy options and recommendations. Next, third part would be about writing. On yeah, I think it's quite a long section here. First about the outlining. Outlines are the core of the writing. So like if the outline is flimsy, then the writing will be flimsy. I really like how all the outlines are already great as well. Despite a short amount of time. Thank you as well to the groups that have allowed me to join in the groups. And then secondly, for the background, this is where we sell the idea, right? Like any topic can be important with the proper background. Then we usually start with the global situation and get more specific to the cause this paper is written. Most groups have also gotten this very good already. And thirdly, on the discussion, sometimes it's mistaken as having a longer version of the background section, but really we want more about what is the cause of the problem. I really like that one of the groups just now talked about, the problem is not about this, it's about the awareness of people, etc. Hence, your policy recommendations are more tailored to what kind of direction. Yeah, I like it when it's an analysis of what's missing instead of just expanding the background. What we are writing in discussion is not a summary of like what's out there, but a synthesis. For example, I noticed one of the groups having the WHO roadmap summary. It's actually good and important, but it's much better when we write it not as a standalone point. It's better if we supplement it with like other resources which provide more insights of what's happening right now and like where are the gaps. But I do understand of the time constraints in writing this under a week. So yeah, still kudos to all of you. Last in writing about the recommendations, it's very, very important to have concrete recommendations. I think many are already quite detailed in this, but it's best to have operationalization and like not stick to the normative recommendations. For example, no hard feelings, by the way. There's a phrase in one of the groups where they recommend the public to be prepared in any occasion of emergency. Like this is rather vague. It's better to refer to some guidelines, for example, like maybe we can recommend the public to be educated on the guidelines from WHO on blah 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 blah, so that yeah, that would be a more operationalized kind of recommendation. Then there's also another phrase, quote unquote, contribute to research development of AT assistive technology. Of course, we all know that this is a good thing, but like what exactly, for example, should we provide more research grants to LMICs? Or should we form consortiums for better research? What ideas are there, especially that we should take? So yeah, operationalization again elaborate on who should do what. Can go from macro, from WHO, UNICEF, and all those international organizations, down to micro as well, from the primary healthcare, hospitals, and like communities on the grassroots level. So yeah, that's on writing. Fourth part will be on formatting. Some groups have graphs, and that's good. Groups 1, 2, 4, and 8 have also tried to incorporate in-text citations. This is a common mistake in like writing. So kudos to groups 1, 2, 4, and 8 who have incorporated that. Some of the other groups are still missing that, and it's a common mistake. Totally okay as well with time constraint here. For the long references, I believe all groups have put in the effort to having Vancouver formatted references. So thank you very much for your effort in that. I've also taken notice that there's an original diagram from group 2. That's really wonderful. We'll need such things as well in the upcoming opportunity. So yeah, that's on formatting. Fifth part, very sorry for the long speech here, would be on presentation. We will be further discussing about how we present these recommendations to stakeholders through Global Health Training 2. It will be about advocacy. But the reason why we cut our presentations in minute 5 is not because we don't want to listen to you, but because stakeholders are busy and we have to ensure that it's timely, you know. And last but not least, sorry, I think I have limited time here, but yeah, last but not least, I would also like to convey to you that there's an opportunity coming up, which is AMSA International Policy Working Group Open Recruitment. It's not published yet, but this will be your privilege to know about it first, since all of you have stuck until the end. Thank you very much. The topic will be on One Health and environmental health. So yeah, do think about that and brainstorm what policy recommendations you think would be relevant to that, and we'll be opening up the open recruitment soon. So yeah, keep in touch with Circle Nation's Instagram and socials for that. Last but not least, so proud of all of you. I hope you'll get amazing insights from this training and bring the knowledge into action and friendship in your respective chapters or local university communities. We indeed need more medical students who are involved in creating and advocating for evidence-informed policy recommendations. Yeah. Thank you very much. And I think after this, we'll be having the most awaited agenda with Stan. Yeah, the time is yours as MC.
Thank you, Sanish, for your insightful feedback. Now, before we announce the best contributor to the Global Health Training, we would like to first announce a round of honorable mentions of participants, recognizing their work, effort, and dedication in contributing to this Global Health Training. Can someone share the screen really quickly for me? Thank you. So this will be the round of honorable mentions for the participants that worked really hard for this policy. Yes. So I apologize in advance for butchering your names, but then here it goes. Okay, next slide, please. So the appreciation for our top group participants from group 1 is going to be John Ajina Liam from Indonesia. Group 2 is going to be Chaitanya Reddy from India. Group 3 is going to be Sia Mohammed Abbas Ali Zaidi from Pakistan. Group 4, Praveen Bahad Saravanan from India. Group 5, Hinlai Ivan Lam from Hong Kong. Group 6, Prachanda Tassim from Indonesia. Group 7, Shili Lai from Taiwan. And finally, Group 8, Stephanie Tong from Indonesia. Congratulations to our top group participants. Okay, so this is the moment you've all been waiting for. The winner of the best contributors of policy writing. You have been observing and evaluating since the preparation stage of writing until today, the finalization of the policy, and we would like to announce the best contributors are, next slide please. Prachanda Tassim from AMSA Indonesia. Congratulations.
Wait, with that, maybe we can take a picture first with
yes.
Prachanda.
So Prachanda, would you mind turning on your camera? Okay. So
okay, I'll be
stop and then yes.
In 3, 2, 1. Okay, thank you.
Congratulations, Rakanda. Now, the next one is going to be Titania Reddy from Answer India. Congratulations, Titania. Would you mind turning on your video so that we can document this? Thank you.
Okay, thank you, Chaitanya. I'll be taking a picture in 3.
Congratulations, Titania. So finally, it's gonna be our last best contributor of GHT1, Hinlai Ivan Lam. Congratulations, Ivan. From Amsterdam, Hong Kong. Ivan, would you mind turning on your camera so that we could document this too?
Okay, 3, 2, 1.
Congratulations, Ivan, and thank you so much for all your effort in this global health training. So, this is the end of our first global health training. Thank you so much for your active participation and enthusiastic response. We hope all of you had a great time learning about writing policy documents, and we're looking forward to see you and participate actively in the upcoming initiatives for the global health sustainability team. Now, before we go, should we all take a group picture together? So if you don't mind, please turn your camera and then we can take a group picture of all the participants from Global Health Training 1.
Okay. Anyone that hasn't turned on their cameras yet, maybe if you guys want to turn your cameras on. Okay. I'll be taking the picture in 3, 2, 1. Okay, second slide. 3, 2, 1. Okay, maybe we can do the AMSA pose. Wait. Gina, can you help me?
Okay. For
The other hand.
or screenshot it.
The other direction, sorry.
Okay, okay. Here?
Yeah, okay, thank you. Okay. 3, 2, 1. Okay, next slide. 3, 2, 1. Okay, thank you so much, guys.
Thank you so much, everyone.
Much
Don't forget to fill
everyone.
in the feedback links given by the OC on the chat box, as there will be your employment for your certificate. Thank you so much. You can either scan the QR code or the link in the chat too. Thank you and have a nice weekend, everyone. Thank you for your efforts.
Okay, GMs and GHOCs, kindly do not leave first because we will be having a debrief. But for the participants, kindly leave the Zoom meeting.